Okay.
Hi, my name is Esther Samokar and I'm going to be performing chest tube dressing change. So I'm going to perform under hygiene and I'm going to go into my patient's room. I'm going to do a quick safety check. My patient is not in any form of distress and call ball is within reach. Hi, my name is Esther Samokar and I'm going to be your sitting nurse for today, okay? Well, I'm here to change your chest tube dressing, alright? I'm going to be cleaning the site, assessing the site and also applying a new dressing that is similar to your old dressing. Can I go ahead to do this procedure? Alright, thank you. So I'm just going to ask you for your name, okay? Okay, right patient is Missing Jason, alright? Your date of birth, 14 February 1959, 14 February 1959. Do you have any allergies I might know of? Okay, allergies, no known allergies, no known allergies. Alright, thank you. So like I said, I'm going to be changing your chest tube dressing, okay? I'm going to be elevating your bed to a semi-phallus position. I'm also going to be raising your bed to my waist level for a comfortable position and a working position for me. So I'm just going to be going over to my sterile table. I'm going to perform under hygiene again and I'm going to be opening my sterile kits. I open the way, this way, and I'm going to pick up my faucet and I'm going to drop the flap down. So I'm going to be picking my drape. So since I don't need this, I can drop this down. So next I'm going to be picking up my bin. So I'm going to drop my forceps. And can I place this at the leg of your bed? Alright, thank you. Okay, thank you, sir. So now I'm going to be picking up my forceps. Okay, so maintaining tip to tip. I pick this up. Also maintaining tip to tip. Alright, now I'm going to be getting my drainage sponges. I pass this to myself and I'm going to open as in a banana clay form. And I'm going to drop this down and I'm going to drop this at the sterile field. Okay, so now that is done, I'm going to be picking up my jelonet. Pick this up. And now I'm going to drop it on my sterile field. And so I won't be needing this again. I'm just going to drop this here. So now that it's done, I'm going to be getting my normal saline for cleaning. Okay, so I'm going to pour gently, making sure I'm not contaminating the sterile area. Okay, so that is done. I'm going to cover up. Okay, so now I can drop this down. I'm going to be wearing my clean gloves to remove the old dressing now. And also assess the sides. Okay, thank you so much, sir. So I'm going to be removing your old dressing now, okay? Okay, so I'm going to stabilize the tube. I'm going to open from the edge. So I can see that the previous nurse already added 2 Mayfix. Okay. Okay, let's open up the edge. Okay, so I can see that some dressing is coming off, so I'll just stabilize that. Okay, so now that is done, I'm just going to assess. I can see that there's no saturation and there's also no drainage. Okay, so I can already see 2 4x4 gauze pads, which is what the previous nurse put. I can throw that away. Okay, so now I'm going to be stabilizing the tube. Okay, and I can see one drainage sponge. There's no saturation and there's also no drainage. I drop that to the bin. I pick up the second one. You can see that there's no saturation also on the drainage sponge and there's no drainage. So I throw. Now I'm going to be picking up my jelonet with the forceps. Okay, I'm going to stabilize my tubing. And I can see that the tubing is attached to my patient's skin, so that is okay. So I'm just going to see there's no odor and there's also no drainage and there's no saturation. I throw that away. Okay, so I'm going to pick that up when I'm done with my cleaning. So I'm just going to be assessing the site so I can see that there's no redness, there's also no swelling, there's also no subcutaneous emphysema, which might indicate infection, and there's also, okay, do you feel any pain? My patient states that there is no pain when I palpate. So now I'm done with that. I'm just going to be removing my clean gloves and I'm going to be cleaning. So I perform hand hygiene and I'm going to be getting my forceps. I pass it to myself. Okay, so I'm going to be getting 1 2x2 gauze pad. I put this into the sterile field, my sterile field, forming a rosette. Okay, I'm going to dip this into my normal saline. I dab. I put this right here into my 1H powder, and now I'm just going to go in a 360 form. Okay, that is done. I put that into the bin. I pick up a second one, put in my sterile field, make a rosette. I put into my normal saline, put this right here, and I'm going to clean the second time. Okay, and pick the third time within my sterile field. I'm going to make a rosette, dab, drop. Okay, I'm going to clean the third time now. I'm going to be cleaning the fourth time within my sterile field. Okay, so I'm going to be cleaning the fourth time now. So next I'm going to be cleaning my tube. My sterile field. Okay. Pick up my last 2x2 gauze pad. Dip. And I'm going to be cleaning under. Okay. So now that is done, I'm going to be drying. Do my sterile field, form a rosette. So I'm going to dry. Dry a second time. Okay, so now that is done, I'm going to let the chest tube dry itself. So now I'm going to be applying the new dressing. I'm going to be using my sterile gloves. Throw that away. So I don't need to perform hand hygiene. So I'm just going to be using the side of my table, my table rather. So touching just the 1H border. Okay, so I'm going to be wearing my right first. Okay, I'm going to be wearing the left. Okay, so now that is done, I can leave that there. I'm going to be getting my jelonet. Twist it. Okay, so now that my jelonet is applied, I'm going to be putting my drainage sponge. Next, I'm going to be adding the second drainage sponge. Okay, so now this is done, I'm going to be adding my gauze pad 4x4. So one is okay. So now that is done, I'm going to be removing this. I can use my bare hands to add my mifix. I can throw that away. And now I'm going to be getting my mifix. So can I put this on your bed, Mr. Mason? Thank you. Okay, so I'm going to be opening one of it. Okay. Okay, I'm going to be opening the second one so that I can tent the tubing. Okay. Okay, so I'm going to tent my tubing. Alright, so everything is done. I'm going to be putting the date and the time that I changed this dressing, and now I'm going to also document and put my signature EOUMSN3. Alright, thank you so much, Mr. Mason, for your time. Okay, so I'm going to place my patient in a comfortable position. Alright, and do you need anything, Mr. Mason? Okay, my patient states it doesn't need anything. Alright, so thank you so much for your time, Mr. Mason. I'm going to be going to my bedroom right now. Alright, so exit safety check. My patient is not in any form of distress and call ball is within reach.